say about mold. When I lived in London, I didn't realize how, I had a whole wall full of black mold. Even mushrooms were growing from there. And it wasn't just there, it was in, every flat I was, every house, everywhere, really. But at the time, I didn't know how bloody dangerous it was. I didn't have a clue of how incredibly dangerous it could be for your health. So, yeah, mold exposure is far more common than most people realize, whether you're living in a humid climate, renting an old apartment, or spending time in a workplace, or living in England. Um, most people experiencing mold toxicity report issues that seem unrelated at first, like brain fog, stubborn sinus congestion, chronic fatigue, unexplained skin irritation, and so on. Because mold toxicity symptoms can look like so many other conditions like asthma, seasonal allergies, or even persistent viral infections, people often go months and years without answers. And while following the twists and turns of a medical mystery can be entertaining on TV, navigating unexplained symptoms in real life is overwhelming, isolating, and exhausting. The encouraging news is that mold exposure can be identified and treated with the right approach. So what is mold toxicity and mold exposure? One of the worst symptoms of mold exposure is actually what it does to the brain. Mold is absolutely horrible for the nervous system and brain, and it really affects big time, like no joke. The problem is that, as I said many times, you do not recognize these things because they just seem unrelated. Like, the sinus congestion, the brain fog, the anxiety, probably, and it goes on and on and on to things that you would not suspect. So when you're exposed to too much mold, spores that you are sensitive to, or certain types of mold known to cause health issues, so you can develop a condition called mold toxicity. Different types of mold are around us all the time, but some are more dangerous than others. Some people have mold allergies, sensitivity to natural occurring toxins called mycotoxins. That mold can emit. People with weakened immune systems from various conditions might also be susceptible to mold toxicity, for instance, Lyme disease. Mold is a common fungus that grows in places with a high humidity level, like basements, bathrooms, you know, um, like roofs with a lot of moisture, pipes, wood, tile floors, ceiling tiles. There are places where water leaks can occur, creating an environment where mold can flourish. You can be exposed to mold at home, at work, structures and buildings with poor ventilation, plumbing, drainage, and more prone to mold growth. Mold and other fungi can also grow in soil, especially in areas with high rainfall, humidity, the tropics, or with lots of decaying vegetation. Mold can grow in water, including tap sources. Exposure can occur from water vapor emitted while showering, washing hands or brushing teeth, flushing toilets, and more. And again, it's all going to depend on how weak or how good your immune system is. So that's going to be really, really important for all this. So yeah, mold that grows in soil and water typically doesn't pose a threat to the general population, but for people who have weakened immune systems or sensitivities, mast cell activation syndrome, which can also occur from it, that's the thing. Who comes first, the chicken or the egg? That's the question, right? So, so yeah, mold toxicity can cause a wide range of symptoms that can be hard for you to describe. So your provider may also have a hard time piecing together why you're experiencing certain symptoms. This is especially true if they don't have experience and training in mold issues. However, your symptoms might not be related to mold, but caused by something else entirely. So what are the symptoms of mold exposure? One of the very typical ones is this, it's a feeling that you are kind of disconnected from reality, like this kind of depersonalization, derealization situation, high anxiety. These would be like really typical ones, or even like a huge depression that you don't know where it comes from without any explanation at all. And also, obviously, fatigue, tachycardia, you're unable to breathe. The same as a mast cell activation syndrome, really, because your body is actually reacting to that toxin or mycotoxins. So yeah, um, it's it's an immune system reaction to mold spores, which typically involves allergy symptoms, allergic rhinitis. This might include a runny, stuffy nose, a skin rash, itchy skin, eyes, asthma, symptoms like shortness of breath, which is horrible, by the way. The second type of mold issue is a chemical and inflammatory reaction to mold. Um, so, yeah, some people, especially those immune compromised or have chronic lung issues, can develop more infection in their airways. So, this infection called mycosis can activate mast cells. Once again, mast cells, which are part of the immune system. This activation can cause symptoms such as coughing, wheezing, sinusitis, cognitive issues, and difficulties. And so, inflammation caused by mold exposure can create symptoms that are back, broad, and very hard to pin down, especially the neurological ones. So, cognitive difficulties, brain fog, poor memory, anxiety, like really high anxiety, pain, especially abdominal pain, but can include muscle pain, similar to what they would call fibromyalgia, because I believe these combinations of toxins are what fibro is anyway. Metallic taste in your mouth, numbness and tingling in extremities or other areas of the body, vertigo, dizziness, tinnitus, the horrible ringing in your ears thing, which is horrific, by the way. Digestive issues, especially, limited tolerance to food, persistent bloating, significant fatigue that interferes with daily activities, changes in mood, excessive thirst and dehydration. Um, in children, it can also cause bedwetting too. Symptoms that resemble hormone imbalances, hair loss, rashes. But this would be a consequence of the mast cell activation that the mold causes. And sometimes, and many times, especially with, Lyme disease people, we have a combination of the whole thing. So we cannot really see or actually know what is it that is causing the problem in the first place. So, is it the mold? Is it the metals? Is it all of it at once? Who comes first, right? Or is it all of it at the same time that's causing a terrain that is just dirty and reacting to all this toxicity and so on? So, mold poisoning typically describes an acute reaction caused by breathing or touching mold spores. This is the type of response that most people think about: sudden coughing, sneezing, eye irritation, or a flare of asthma like symptoms after encountering visible mold in a bathroom, basement, or down building. These reactions are usually immediate and often improve once the mold source is removed. But then other times, already you have created a terrain inside of you where all this mold toxicity, all this mold is already in there going on. So it's hard to. So mold toxicity, on the other hand, involves a deeper, more systemic response, often from ongoing exposure to mold or its byproducts known as mycotoxins. These tiny compounds can trigger inflammation pathways throughout the body, leading to chronic symptoms like persistent fatigue, brain fog, headaches, digestive issues, hormonal imbalance. Because these symptoms develop gradually and affect multiple systems, mold toxicity can be harder to identify and is frequently misdiagnosed. So yes, understanding the difference between mold poisoning and mold toxicity doesn't just offer clarity, it helps guide to the next steps of treatment in your care, from identifying possible sources of exposure to creating a personalized plan to support recovery and reduce all this inflammation created by it. So why are mold issues so difficult to diagnose? The topic of mold toxicity or injury is controversial once again. I don't understand why, but it is. Because, in the past, we used to live with the same mold as well. You have to take in mind, for instance, that Wi Fi grows mold. So, therefore, since we are a lot more exposed to all these, you know, um, frequencies and so on, and our immune systems are a lot weaker, and our, gut microbiome is a lot weaker, and all the metals and crap in the environment is going to make us a lot more, let's say, prone into getting mold poisoning. So yeah, so doctors largely recognize that mold can trigger allergies and asthma, and that mold can sometimes cause lung infections. They also recognize that overexposure to mold in the workplace or at home might be linked to pneumonitis and HP that can occur when people inhale problematic dust, which can be contaminated with mold. So ultimately, more research is needed to uncover the best strategies, determining if someone's symptoms are related to mold exposure or not, But then once again, most people have a combination of all of it at once, which is what we end up calling chronic Lyme disease, because all of it is mixed up in a, so you no longer know what's coming in the first place anymore. So conventional medicine recognizes, all of it, but yet they are really not good in actually diagnosing it. So yeah, fortunately, root cause medicine providers consider environmental factors that affect health when evaluating patients, and might have additional advanced training in treating mold exposure symptoms. One of the biggest challenges with mold is that mycotoxins can cause only some people to launch inflammatory response. This unpredictable response can go on for years after long-term exposure in a susceptible individual. So ultimately, if you are experiencing unexplained symptoms that are affecting your quality of life, and pursuing the root cause is important. The symptoms might not be due to mold at all. It can be, other things too. But many times, many times, this is in the mix, or the root cause on itself. So how do you test for mold exposure? So, a functional medicine doctor often uses targeted labs to get clues about mold exposure, then build a plan that blends clinical care with nutrition and lifestyle. All in all, there is no simple way to diagnose mycotoxin illness, really. But, going to these kind of doctors is going to give you some reference and a good start into understanding if this is your root cause or part of it, or, also, you can use urine analysis. You pee into a cup, and your provider measures your urine for metabolites of mold and mycotoxins, as well as glutathione levels, as glutathione is an antioxidant the body makes. So levels can be depleted when you're exposed to mold, but they can also be depleted when you're exposed to other similar toxins. So there you go. So, you know, I would never place the entire diagnosis of mycotoxin illness on alone, because many times it comes together with other things already as your immune system fails, such as, Lyme, its co-infections, parasites, metals, and so on. So let's talk about the the goth one, let's say. Black mold. There you go. Black mold is one specific type of mold. Instead, it's a term used to describe the color of several different species, usually those that are green or black. A common type of black mold is Stachybotrytis chartarum. A fungus color doesn't dictate how it affects your health according to the CDC, but according to the CDC, we would all be dead, right? So in 2023, there's a study in the Journal of Behavioral Brain Research showed that mice that inhaled this kind of mold experience really severe cognitive issues. The symptoms were also linked to brain inflammation, because one of the things that mold does is trigger an inflammatory response in your microglia, or basically yeah, neuroinflammation. So therefore, many symptoms that could be confused as madness, anxiety, depersonalization, are these neurotoxins playing a huge part in this neuroinflammation. So yeah. So how do you treat mold toxicity symptoms? So there are a lot of experts recommending a handful of supplements and strict diets, but the reality is we just don't know for sure if they are the right treatment approach, because again, this is going to be very individual for the person, and very individual in the fact that you might have many other things going on. I mean, it's obvious that you have to remove yourself from the source of mold, so you have to get away from the mold area. But sometimes that helps people recover, and others, you have to treat the whole thing. So let's say, and remove yourself from the place at the same time. So killing the mold or mold remediation offers a first step, but supporting the immune system usually gets more attention. As I often I wouldn't focus on killing mold, since most symptoms are due to the immune response, not the mold itself. Instead, with simple lifestyle steps and utilizing non-pill practices to achieve a state of better immune health, eliminating exposure, for instance, the sources of mold from the environment if you can, but also eliminate common dietary sources of mold, including grains, coffee. That's a huge one for mold. I mean, if you do actually drink coffee, make sure the coffee is not moldy. Basically, some labels, like the Evasparis ones, are You can already see that they've been checked for mold, but many others don't. Chocolate would be another one, peanut butter. And so, yeah, this is going to help reduce the overall mold burden on the body. So, address sinus health. Since mold can colonize the sinuses, uh, the nose throat doctors know well that you can also take steps to improve sinus health at home, including healing the gut, basically, since 70 or 80% of our immune system is located there. Address lung health. If you have asthma, you know how important it is to maintain lung health with your regular regime, but sometimes exacerbation with these conditions occur and could be brought on by mold. So, start a neural retraining program, because one of the things that mold does is make your nervous system go nuts, absolutely nuts. So therefore you need to find a way to calm this reaction down, so your muscles also calm down as all this works together. So yeah, our autonomic nervous system has two main branches: the sympathetic nervous system, the fight or flight response, and the parasympathetic nervous system, which is the rest and digest, right? So when you are not feeling well, experiencing airway inflammation, the nervous system can engage into chronic fight or flight response. Your body is in danger, therefore it reacts accordingly, creating this response where it's basically telling you, hey, there's something going on, but yeah. So no pill can fully stop this response, so we have to retrain certain neural pathways to put the response into the heal and rest state. Another way to help this is using microdose psilocybin to calm this reaction down and to change the state of the nervous system. That's really, really helpful, and in my case it's been amazingly helpful. So lower inflammation, taking steps to lower inflammation can help return balance to a compromised immune system. This means following an anti-inflammatory diet, committing to daily stress management habits, which goes hand in hand with the nervous system situation, eliminating added sugar, eliminating ultra processed foods, eliminating intake of processed carbohydrates, reducing intake of omega 6 fatty acids, boosting intake of omega 3 fatty acids, and fiber. So, yeah, this would be like the main things. But all this mold that your body is gonna slowly start to get rid of needs to be cleared. And to clear it, we need our liver. And sometimes, and many times, our liver is basically like if we were like 24/7 alcoholics when we are not, and we have to take good care of it. As I said before, mold gets, it just sucks up all your glutathione, therefore you're gonna get toxic from everything, and you're gonna be unable to detox properly as well. So supporting the body's natural ability to get rid of toxins is a key part of helping of healing from mycotoxin exposure. So supplements can be helpful. So, some options would be NAC, N-acetylcysteine, charcoal, bitter greens, which all support the liver. It's important to work with a practitioner, in the more illness area, because of how the order affects the result. No, you have to also work on bile, as bile is gonna be. Some people use like um, I can't remember how they're called, bile binders, basically, like cholestyramine and so on. Don't have experience with it, but it can be useful for some people. And yeah. So addressing the pre-existing, all the things that are going on, if you have all the things happening at the same time, which could possibly be related, obviously, because everything is at the same time, is gonna help. So then again, usually it's not this alone or this on its own. It's a combination of things happening at once, and we need to fix why and understand what comes first. But it's very important, at least, to make sure that you are not exposed and that you are able to detox what your body is trying to get rid of. Otherwise, you're in a loop where you are constantly intoxicating yourself, and that makes no sense, right? It's a slow and horrible process, especially when it's affecting the brain, and it can be horrific, but worth it. It really is worth it. So preventing more exposure would be wise, but the problem is that we realize all these things when we are already incredibly sick or really sick, and that's the issue, right? So assess your home for any leaks and repair them. If you rent, talk to your landlord about mold concerns. Run ventilation fans when showering, bathing, and cooking. Ensure that your dryer vent is in good condition and ventilates outside. If your home is especially humid, run a dehumidifier. Clean your home regularly and look for mold growth. Uh, wear a mask when cleaning. Uh, Add mold inhibitors if you point your home or rental. Remove and musty carpets or rugs. Clean out your home immediately after a flood. If you suspect mold exposure in your workplace, then obviously talk with your boss, whatever you have to do. But the trouble is that, again, we realize all these things when we are already sick. I mean, I had no clue in the past. I really didn't think about it. Life is too complicated already until you're sick, and then nothing else matters apart from being healthy again, right? So I wish we knew about all these before we had to go through all these nightmares. But yeah. So, more toxicity, you know, like questions, let's say, but and truths about it. So toxic genetic molds can cause inflammation that might lead to mold toxicity symptoms. A common one is the black mold, what I just said. There are many others like Aspergillus species and so on. And yeah, the color of mold doesn't really dictate its danger level, but all types of mold, including black mold, can cause reactions in those who have mold allergy or sensitivity. And usually this has to do a lot about how well your body detoxes. So, can you heal from it? The short answer is yes. The first step to healing will be to avoid all this exposure. This might involve taking more remediation steps, changing diet, and more. The second will be incorporate health and lifestyle changes. This might include addressing allergies, supplement, changing diet, reduce inflammation, and so on. And many times, avoid radiation too, because of, again, it doesn't sound related, but it really is related. How you can really see if you put anything next to a Wi-Fi router, how mold grows at such a terrifying, you know, it is so fast. It's actually scary how it works. But yeah, and if you're struggling with it, once again, you'll be out of it. Don't panic. It's horrible, and usually, again, it comes along many other things happening in the body. But for some people, this is the root cause. So in each individual, that's why we have to treat this as an individual. In all these, I don't even want to call them diseases because they are not. They are, let's call them long-term toxicity, and immune reactions. Uh, but again, they're not chronic. You can do something about it. Yeah, so I hope you enjoyed the video. I wish you the best and hold on, and I'll see you next time.